Dr. Sahakian, Medical Director of Pacific Fertility Center. I would like to go over the gestational surrogacy and egg donation process as a practical guide, and I will go over the different steps that a couple or an individual has to take in the process of achieving the goal of having a family through this process. The first thing I would like to talk about is the FDA regulations. In 2005 in the United States, the FDA came up with a regulation stating that if you are to use a surrogate, basically a male individual is to use a surrogate and is using his sperm, he has to undergo a certain infectious screening, certain tests, FDA required tests, before being able to produce sperm to fertilize eggs to produce embryos. So basically there were some limitations placed by the FDA. Namely, if you are an anonymous donor, you have to quarantine your sperm for 6 months. But if you know the surrogate, so actually there's a relationship with the surrogate, even if it's just meeting the surrogate, you are known as a known donor, in which case you can produce a fresh sample of sperm as long as you are tested within 7 days of producing that sperm sample to fertilize the eggs. So these new regulations put some limitations on the treatment. Namely, you have to use a certain laboratory associated with a certain physician in the United States to do the tests required by the FDA to produce the sperm to produce embryos and have a child. So what are the steps that a couple or an individual has to take to go through this process? The first thing you need to do, in my opinion, is find your surrogate or your surrogate agency. There are many agencies around the country, and sometimes it could be very hard to find a surrogate agency. So do your research. You need to look at different variables when you look at the surrogate agency. Look at the experience. How long have they been doing this? How many patients they've treated? What type of success they have? Look at the reliability. Are they reliable? When you call them, when you email them, do they return calls? Is there a person behind a telephone number, or do you get an answering machine? These are things that are very important, in my opinion, that when you pick your surrogate agency, there is a good relationship. In addition to the cost, obviously, and there is a big variation in cost between different agencies, but as a general rule, I would say that this process is very expensive. And most agencies are in the same range, and it could vary, obviously, depending on which agency you choose. But look at around $100,000 to $125,000 to go through a process of egg donation and surrogacy. So occasionally you would be able to do this with much lower, $75,000 to $80,000. But in general, you have to budget for around $100,000 so you don't have any surprises. So step one, find your surrogate agency. And I say that as a step one simply because it takes sometimes a long time to find a surrogate. A minimum of 2 to 3 months, in my opinion, sometimes 6 to 9 months. So before you start looking for an egg donor or even a doctor, identify your surrogate agency. If you have your own surrogate, obviously, then you can start the process faster. But if you don't, find your surrogate agency first. Step two, find your doctor. And that could be also a tough process. You have to compare doctors. Ideally, you should talk to as many doctors as you can and hear about their program, understand their success rates, etc. No one walks on water. I don't walk on water. We all have good pregnancy rates, and I always say to couples, gay men or individual men who want to have a baby, is that you don't have infertility. You will have a baby. It's just a matter of time, and unfortunately a matter of money. I hate to admit that, but that's the case. If you can afford to do this, you will have a baby. Invariably you will. It doesn't matter if you come to me or you go to any other doctor. Most doctors in this field nowadays have very good success rate. Having said that, I still do believe some doctors have slightly higher pregnancy rates than others. And sometimes, unfortunately, it might have to come down to comparing doctors based on the financial packages they offer. And at Pacific Fertility Center, we have come up with very specific packages that you're welcome to check on our website, whereby we offer unlimited IVF cycles for a fixed price, all-inclusive, whereby the couple doesn't have to worry about additional costs once they've signed out with our program. So basically, you pay a single fee That includes all donor screenings, all surrogate screenings, all medications, etc., for unlimited number of IVF cycles until you have a baby. And the reason why we came up with such a program is, obviously, we believe in our pregnancy rates. We believe that we can get you pregnant sooner than later. And we wanted to differentiate ourselves from other programs. And if everybody says they have great success rates, then they have to match these rates, these offers, these packages. And if they don't, we hope to stand out, and hopefully that will make you make a decision maybe if all else is equal. So step 1, choose your surrogate agency. Step 2, choose your doctor. Step 3, you need to choose your donor. Choosing a donor is quicker than finding a surrogate because there are so many donor agencies. There are literally dozens and dozens of agencies just around Los Angeles alone. So you have access to hundreds and hundreds of donors, and even if you're picky, you will find an egg donor sooner or later. You control that process. Unlike surrogacy, whereby the agency would present you with a surrogate and you really don't have much to say, unfortunately. You can say no, but in general, surrogates are screened, so you don't care how the surrogate looks, you don't care about a lot of the genetic aspects because it's not transmitted to the child. But when it comes to an egg donor, you really have to be careful. You have to be picky. You need to basically choose a donor who you like, who you want to transmit the genetics to your child. So picking a donor, you have to first say, where do we look? Well, you go through the internet, you Google egg donation, and you'll get tons of responses, many agencies. Then what you need to look is start looking into the databases. Put some criteria for what you want. In general, you want to look at age as a very primary criteria because pregnancy rates are much higher the younger the donor. So I recommend finding donors less than 30, but you have to understand that the donor who's 21 will give you a better chance than a donor who's 29. Now, if you want to pick a donor who's older, you can, even a 33, 34-year-old donor. Sometimes you have to bring a family member, a sister, who you would like to use. And that's fine. We can test these women and we can tell you actually if she's a good donor or not. If you go to an agency, however, it's better to pick a younger donor and to basically to increase the odds of having a successful cycle from the first attempt. Another thing it's important to understand is that the location of the egg donor is not that important. So a lot of couples I see, they say, well, does the donor have to be in Los Angeles? No, she doesn't. She can be anywhere. Does it add to the cost a little bit? Sure, because the donor has to travel to Los Angeles and stay here for about 3 to 5 days. But in the big scheme of things, and given how expensive this whole process is, if you like a donor who lives in Boston, well, then use that donor. We can do the treatment and monitor her locally and then just have her fly in for the last few days of the treatment cycle. And this way you have access to many more donors rather than donors just in your hometown. The next step in this process is the testing phase. So just to recap a little bit, step 1 is find your surrogate agency. Step 2, find your doctor. And then the third step is find your donor, choose your donor. And once you have identified the donor, then the fourth step is what I call the testing phase. All parties have to be tested. The intended parents have to be tested, the donor has to be tested, and the surrogate has to be tested. The testing is not a complicated process. And what we basically do is do a physical exam, do some blood tests, check for infectious diseases, check for certain variables that can affect the pregnancy, especially in a surrogate. We check the uterus to make sure that she's capable of carrying a pregnancy. In a donor, we check the ovaries, the ovarian reserve to see and kind of estimate how many eggs she's going to produce. So when you pick a surrogate or you are matched with a surrogate, the surrogate will undergo certain tests or a screening. Then when you pick your donor, the donor goes to the doctor to undergo her own screening. Occasionally, the doctor will actually drop the surrogate or the donor as a candidate because of an abnormal test result or an abnormal history, medical history that's not commensurate with being a surrogate or a donor. The testing for all parties have to be done before the treatment starts, obviously. The intended parents have to have a semen analysis, they have to have some blood tests looking for infectious diseases such as HIV, hepatitis, etc. Once the testing is completed, which takes usually 2 weeks, then we're really ready for the treatment phase. Now, the process of egg donation and surrogacy is actually very quick the moment you have an egg donor and a surrogate. What takes time is to find that surrogate. And once you have a surrogate match and you typically look for a donor, and you can typically find a donor within a couple of weeks, the treatment phase, which is the next phase, the fifth step, is very quick. What we do during the treatment phase is once all the tests are back and we wait for a legal clearance from the agencies telling us basically, okay, both donor and surrogate and intended parents have signed their contracts, please proceed with treatment. We'll go ahead and plan that treatment. The treatment phase takes about 5 weeks, and during that phase, I basically synchronize donor and surrogate by putting them on birth control pills. And it's very easy to do, whereby we tell these women to inform us when they start their cycles or their period. We put them on birth control pills, and within 3 to 4 weeks, they're synchronized. We can stop the birth control pills and have both women start their periods at the same time. At that point, the egg donor will take fertility hormones to produce eggs, and the surrogate will take hormones to prepare the uterus, the lining, to accept embryos. The monitoring is done where the donor or the surrogate lives. If they live in LA, obviously I will be the one doing it if I'm your doctor. Otherwise, they can have that monitoring done locally and then basically travel back to Los Angeles just for the tail end of the treatment, which is no more than 7 to 10 days. During this treatment phase, the intended parents are aware of what's going on. They know exactly what the donor is doing and what the surrogate is doing, how many eggs the donor is producing, how things are progressing. And at one point, they will be notified that the donor is ready for a procedure called egg retrieval. This is where we basically go in through the vagina with a needle under anesthesia and retrieve the eggs that have been growing over the last 10 days since she started fertility hormones. The eggs are then taken, and in general, if we have a couple, we would divide the eggs in half, but again, we can divide those eggs in any proportion the couple desires, and we would fertilize those eggs with the sperm. The next day we get embryos. The embryos are left in culture for about 5 days. At that point, the surrogate comes back and we will transfer 1 or 2 embryos into the surrogate uterus, which is a very simple procedure called embryo transfer. There are some decisions to be made at this point whereby the couple has to decide whether they're transferring 1 or 2 embryos, and the success rates vary. Obviously, they're somewhat higher when you're transferring 2 embryos, in the range of 70 to 80% chance, where obviously with 1 embryo you're going to get slightly lower pregnancy rates. Also remember that some surrogates, even if they get pregnant, they would miscarry, so you have to take that into account ultimately as far as your chance of having a baby. But this is a very successful process. We're getting very high success rate. The majority of couples will be pregnant within the first 1 or 2 tries. Once the embryos are transferred, typically the surrogate stays in the clinic for an hour, then goes home, rests for a day or 2. And then we recommend the first pregnancy test to be done 10 days later. Once the pregnancy test is done, and if we confirm a pregnancy, then typically we recommend that the surrogate undergoes an ultrasound 2 weeks later to determine if there is a viable pregnancy and if there's 1 or 2 babies. If the surrogate lives within this area, within a driving distance of my clinic, for instance, they would be coming here for their ultrasound. Otherwise, they can have their obstetrical care locally wherever they live. If the patient lives here, if the surrogate lives here, I will typically follow the patient till they're 10 weeks pregnant. If all is going well, at that point we release them to their obstetrician for their OB care. The couple should always stay in contact with the surrogate during this process, or the individual intended parent. You have to have a very good communication, support her. If possible, if you're local or your surrogate lives close by, go to the obstetrician with her for her visits. If she lives far away, then you could basically make 1 or 2 trips during the pregnancy for support and also to see your baby or babies. And at the end of the road, hopefully there's a successful outcome. You will go retrieve your babies once they are born.